One of the obstacles that you have to overcome is creating awareness, both for the disease itself and for the device. And the president's diagnosis has already brought a huge amount of attention to CVI. We regularly track search terms, and the amount of searching that's gone on a national basis for the terms CVI and chronic venous insufficiency has really gone through the roof. And as you know, Dr. Glickman has already appeared on national news broadcasts and in podcasts, etc. So, whether the president's disease progresses to where he might need a VenoValve or not, his CVI diagnosis brings the type of attention to the disease that you really can't buy, and that's really important for a successful device.
Welcome back, and thank you for joining us for another Virtual Investor What This Means segment. Today we are featuring enVVeno Medical. My name is Janine Thomas. I am CEO of JTCIR, and I will be the moderator. Before we get started, I would like to remind our audience that enVVeno is publicly listed on NASDAQ and trades under the ticker enVVeno. And during today's discussion, the company will be making forward-looking statements, and I encourage everyone to view the company's latest SEC filings on their website at enVVeno.com for the latest information. As some background and to set the stage for this segment, President Donald Trump was recently diagnosed as having chronic venous insufficiency, also known as CVI, with enVVeno Medical being the only publicly traded company that is focused solely on treating CVI. We wanted to touch base with the company to see what the president's diagnosis might mean for the future of the company. With me today is the CEO of enVVeno Medical, Rob Berman, and enVVeno's Senior Vice President and Chief Medical Officer, Dr. Marc Glickman. Dr. Glickman was a practicing vascular surgeon for over 40 years. Welcome, gentlemen.
Hi, Janine.
So happy to have you join. So we're going to dive right in. Rob, were you surprised when you heard that the president was diagnosed as having CVI?
Hey, Janine, and thanks for having us today. Honestly, I really wasn't. Millions of people in the US have CVI. And over the past several years, whether we're on road shows, I'm on an airplane, just about everywhere I go, I run into somebody that has CVI. If you recall, even one of our directors of our company had CVI. So, CVI really occurs across all races, ethnicities, income classes. And so it really wasn't a surprise that the president would get a CVI diagnosis.
So, Dr. Glickman, can you start out by telling us how CVI is diagnosed in terms of severity?
Certainly. First of all, it's the clinical examination, Janine. You look at the lower extremity, you look at the leg, you look for signs and symptoms of swelling or edema. You look for signs of discoloration of the skin, some pigmentation, some different discolorations that you're concerned about. You look closely at the surface to see if there are small veins called reticular veins. And then you also assess whether or not the patient has varicosities of their saphenous vein or other veins in their lower leg. So, first of all, is a clinical assessment, a visual assessment of the leg. After you look at the patient and you consider that they have CVI, you then would get a duplex ultrasound of the lower leg of the veins to determine whether or not they have CVI, both in either the deep system or superficial system.
Very helpful background, Dr. Glickman. So, based on your understanding, what severity of CVI does the president have?
Well, I've seen some pictures of his ankles, and I do believe he has discoloration. We do know he has edema, swelling of his legs. He has moderate disease. The White House used the term benign. That's not the term we use in vascular surgery when we're talking about venous disease. We talk about mild, moderate, or severe. And President Trump has moderate disease. He has edema, and he has some discoloration at his ankles.
So, Dr. Glickman, is it possible that President Trump could be a candidate for the VenoValve someday? And if so, when?
Yes, he could possibly be if his disease progresses. And let me give you an example. Patients with moderate CVI that President Trump has can have a higher incidence of developing a blood clot or DVT in their lower legs. And we know President Trump travels extensively, long trips to Asia or Europe, higher likelihood of getting DVT in those lifestyles. Number one. Number two, getting in and out of a golf cart or against the desk of his in the Oval Office, he can hit his ankle or his leg and get an ulcer or a wound in a leg, which would take a long time to heal. We're talking about months to heal these. The normal person would maybe take two weeks, but with patients with swelling and edema, it would take months with patients with CVI. So when you go to a more severe disease, we certainly will be available once approved to implant a VenoValve into his femoral vein.
Appreciate that background, Dr. Glickman. So, turning back to you, Rob, what potential impact do you see President Trump's CVI diagnosis having on enVeno Medical?
Well, whenever you launch a first in class category, like we hope to be doing for the VenoValve, one of the obstacles that you have to overcome is creating awareness, both for the disease itself and for the device. And the president's diagnosis has already brought a huge amount of attention to CVI. We regularly track search terms, and the amount of searching that's gone on a national basis for the terms CVI and chronic venous insufficiency has really gone through the roof. And as you know, Dr. Glickman has already appeared on national news broadcasts and in podcasts, et cetera. So, whether the president's disease progresses to where he might need a veno valve or not, his CVI diagnosis brings the type of attention to the disease that you really can't buy, and that's really important for a successful device. And while we certainly wish the president well, if his CVI progresses and does become severe, we'll be ready both in terms of leading the national conversation and with what we expect will be hopefully the only FDA approved option to treat his disease.
Rob, we certainly do wish the president well. Speaking of FDA, when do you expect to hear from FDA?
We're on track for a decision later this year.
Well, that's exciting, exciting times ahead for enVeno Medical. Can't wait to have you guys back to hear the decision from FDA. This does conclude our What This Means segment featuring enVeno Medical. I'd like to thank Rob and Dr. Glickman for joining us today. We look forward to having you back in the future for sure. And to our audience, thank you for your time and attention. If you like what you saw today, I encourage you to visit enVeno.com for more information on the company and to sign up to follow the company to receive their alerts as well as follow their social channels to stay current on the latest information. And as a reminder, enVeno trades on NASDAQ under the ticker enVNO. Thanks again, gentlemen. Thanks to our audience, and I wish everyone a great rest of your day.